warahmatullahi wabarakatuh. Welcome, dear student, to another video in forensic medicine and clinical toxicology. This is the second part of the lecture about toxic gases. Here are the objectives of this lecture. We will start by talking about another chemical asphyxiant, which is hydrocyanide. Hydrocyanide is an extremely toxic gas. It's a volatile organic acid. Cyanide salts has local corrosive effects when it comes in contact with skin or mucous membranes, and it gives the taste of bitter almond, similar taste to bitter almond. Sodium and potassium salts, when ingested, of cyanide, when ingested, they are transferred into hydrocyanide or hydrocyanic acid inside the stomach by the action of the gastric HCl. So they are not effective in poisoning in cases of achlorohydria. A historic example for this would be the Russian monk Rasputin. He was poisoned by sodium or potassium cyanide, either one of these salts, but the poison didn't do any harm to him because he had achlorohydria, which is the genetic absence of gastric acid. So the poison didn't cause him into death. The mechanism of action of hydrocyanides is very rapid and is fatal. It unites with the ferric ions of cytochrome oxidase respiratory enzymes, leading to paralysis of these enzymes. This in turn will lead to toxic effect on the tissues, where they cannot absorb the oxygen from the hemoglobin, and the oxyhemoglobin will pass into the arterial blood, a condition that will lead to cellular hypoxia. Oxyhemoglobin passes through the tissue unchanged into the venous sides, and this is why it is called red asphyxia, because the oxyhemoglobin remains in the veins, giving the body a red color, cherry red color of oxyhemoglobin. When we speak about mode of toxicity, accidental toxicity would be the most common form of toxicity. Cyanide is widely common in occupations such as agriculture, industry, medicine, and even around the household. In agriculture, cyanides are incorporated into fertilizers and plant fumigants. In industry, these are some examples of the cyanide compounds that are used in manufacture of chemical synthesis of many compounds. It is commonly used in photography, electroplating, and cleaning of metals. In medicine, sodium nitroprussides also contains cyanides, and it is one of the antihypertensive drugs that are used in medical emergency. Other measures around the house will be insecticides, especially for cockroaches, mice, and rats. Some plants, edible plants, contains cyanogenic glycosides, which releases cyanides in the stomach by the effect of the gastric acid. Examples for these plants would be bitter almonds, cherry, unripe guava, plums, and maize. Also, cyanide gas is released by the combustion of wool and silk. So in accidental fires, if the fire incident had a lot of fabrics such as wool and silk, fire workers will be, or firefighters will be exposed to these fumes upon this accident. Suicidal form might not happen because it is a very fatal compound, and but it has been reported, especially among chemists and pharmacists who understand the efficacy and the potential toxicity of this compound. Homicidal, it's very rare because of the rapid action of the poison, which does not give any time for murderers to leave the scene of the crime. However, gas chamber is one of the legal execution methods in the United States for the sentences. If we speak about the fatal period following exposure to cyanides, you have to know that cyanide is one of the most catastrophic and rapidly acting poison that is ever known, and this is expected within few minutes after exposure, around 10 minutes, and it might be developed within up to 4 hours in case of potassium cyanides, because of the action of the gastric acid on the cyanide. It takes time. However, it's only a few seconds. The fatal period is only a few seconds in cases of gas chamber execution method. When we speak about the manifestations of acute poisoning, it will be in the form of immediate loss of consciousness. Characteristic cry is called the cyanide cry, due to the occurrence of sudden severe contraction of the laryngeal muscles, which will lead to a very high voice of pain, convulsions with froth around the mouth. The pupils will show dilatation. The skin will be red and cold and clammy skin because of the venous high oxygen tension in the venous side of the blood. Sometimes there will be the smell of the bitter almond in the breath of the person, but it's not everyone can identify this characteristic smell. This will occur within 10 minutes due to respiratory failure. If we talk about the vital signs, we will see weak pulse, hypotension, very low blood pressure because of the circulatory collapse. Respiration would be decreased, and hypothermia. In case of potassium cyanide ingestion, there will be gastric irritation, of course. If the patient can give complain or talk, he will complain of nausea, vomiting. There will be gastric pain, and usually death occur within the first 4 hours after ingestion. Accordingly, 4 points are of major diagnostic importance: the sudden onset and catastrophic course, the characteristic odor of bitter almond, the bright red color of skin, and knowledge of the patient occupation and or suicidal tendencies. Speaking about chronic toxicity, this could happen from chronic exposure to cyanides or at low concentrations for long period of time. Toxic manifestations will include, if it is by cyanogen chloride, with repeated inhalation, it will affect the larynx, leading to hoarseness of voice, irritation of the mucous membranes, such as conjunctivitis, and irritation of the skin in the form of dermatitis. In cyanides inhalation, the same as cyanogen chloride, irritation of the respiratory passages. But if ingestion happened, the patient will suffer from ataxic neuropathy. Acrylonitrile is associated with increased incidence of cancers, so it is a carcinogenic compound. And laetrile is another anti-cancer. However, it produces severe agranulocytosis on long-term therapy. So blood picture monitoring is very important. If we speak about management, first of all, I need you to understand this is a condition of serious medical emergency that requires treatment at the scene of exposure for life-saving, and this necessitates the presence of the cyanide kit. The basic goal of the cyanide kit is to prevent further absorption and transfer the toxic compound inside the body into non-toxic compound that can be excreted through the kidneys. The first two compounds is amyl nitrite pearls and sodium nitrite. As I mentioned, the basic goal of these two compounds is the formation of methemoglobin. Methemoglobin has higher affinity for hydrocyanides than cytochrome oxidase. Thus, it will form a compound known as cyan methemoglobin and letting cytochrome oxidase free. Then comes the role of sodium thiosulfate, which interacts with cyanomethemoglobin to produce non-toxic thiocyanate that will be excreted in urine. Other measurements will include artificial ventilation, especially 100% oxygen. Hyperbaric oxygen has a role in this because in the treatment of acute cyanides, but it is still controversial. Other drugs will include hydroxycobalamin, which form non-toxic cyanocobalamin, aminophenols, which is a newly introduced drug that it is proposed that have ability to generate methemoglobin faster. Other measures will include gastric lavage if it is available. It is performed using one of these oxidizing agents, sodium thiosulfate, solution hydrogen peroxide, iron salts to convert the cyanide compounds into non-toxic ferrocyanides, or potassium permanganate. Also, the patients need observation, should be kept for observation for 2 days, and if the signs of toxicity persist or reappear, maybe they will repeat the antidotes or the cyanide kit again. In case of suicides, close observation is also suggested, and psychotherapy, because it is unlikely that a person would use a highly toxic compound to commit suicide. So psychotherapy would be a mandatory step after this incident. If we speak about post-mortem examination, the cadaver will have the smell of bitter almond, especially in the blood and the viscera, the red coloration of the skin, mucous membranes and the viscera. For the stomach, the gastric contents will be alkaline, and the gastric mucosa would show signs of irritation such as hyperemia and erosion. Generally, there will be a post-mortem picture of asphyxia with external and internal signs. Now we move to another gas. It's called hydrogen sulfide. Hydrogen sulfide is released from natural sources, including decaying organic materials, natural gas, volcanic gas, petroleum, and sulfur deposits. Hydrogen sulfide is routinely generated in agriculture process and during exploration for oil and natural gases. It is highly toxic, colorless, but gas which is heavier than air, so it's usually in the places below the surface of Earth. It has a very characteristic odor of rotten smell. Poisoning with hydrogen sulfide sometimes results in significant number of fatalities, and at high concentrations it leads to paralysis of the olfactory nerve because of the severe irritation, resulting loss of smell sensation. If we speak about the mechanism of action, it causes cytotoxic anoxia because it causes inhibition of the mitochondrial cytochrome oxidase, and will form inhibition of cellular utilization of oxygen, and this will lead to metabolic acidosis as a result of the anaerobic metabolism of the body tissue. The clinical manifestations will include history of exposure to gas with rotten egg smell. There will be local irritation of the respiratory mucosa in the form of cough, dyspnea, sometimes hemoptysis, progressing into pulmonary edema. Central nervous system manifestations will include headache, dizziness, convulsions, sometimes vertigo. Cardiovascular manifestation will include hypotension, tachycardia, or any kind of arrhythmias. GIT irritation will be in the form of nausea and vomiting, and if there will be also manifestation of dermal irritation in the form of erythema and the bluish coloration of the skin in the form of cyanosis due to the anoxia of the tissues. Irritation of the eyes will lead to keratoconjunctivitis, blurred vision, photophobia, and blepharospasm. Management of cases of poisoning with hydrogen sulfide will include a removal of the patient from the site of exposure, stabilization of the patient's general condition, decontamination of the skin with water and soap, also administration of 100% oxygen, and then symptomatic treatment for seizure and circulatory collapse, pulmonary edema. Toxin-specific therapy, it will be similar to cyanide by amyl nitrate and sodium nitrite to form methemoglobin. Methemoglobin binds with sulfide ions, removing them from the cytochrome oxidase enzyme. Now we speak about carbon dioxide. Carbon dioxide is a non-irritating, colorless, odorless, inflammable gas with highly sour taste. Carbon dioxide is a normal constituent of the atmosphere, and in human body it is considered as a major cellular buffer. The current tolerance limit of carbon dioxide will be 0.5%, and this would provide a good margin of safety if a person stays in such atmosphere for around 8 hours daily, provided that normal amounts of oxygen are inhaled. Concentrations below 1% are usually also well tolerated without immediate health effects. Sources of carbon dioxide is one of the gases that is found in mines and natural gas wells. Carbon dioxide is expelled into atmosphere from Earth via springs, wells, and volcanoes. This graph shows give you an idea about carbon dioxide emissions in the environment. Carbon dioxide has many uses. It is widely used in industry, for example, textile manufacture, leather, paint industries, and even in research labs. It is used in the manufacture of some drugs. It is usually stored in large cylinders and tanks under pressure, and usually it is stored at low temperature in solid forms, like in case of dry ice. It is used mainly as a refrigerant and chilling agent. Because CO2 is relatively inert, it is used in fire extinguishers, as an aerosol propellant, and as pressure medium in food preservation. It is also widely used in the manufacture of carbonated drinks. Carbon dioxide is used in beet sugar production and can be dangerous in high concentrations. And medical uses of carbon dioxide is during laparoscopic procedures in the abdominal cavity to visualize the peritoneal cavity. Acute toxicity manifestation will include, it depends on the level of carbon dioxide. If it is below 3%, usually no symptoms appear. If the concentration is above 33% for more than 30-minute exposure, dyspnea they will have dyspnea or headache, because carbon dioxide causes vasodilatations of the meningeal vessels, and also carbon dioxide causes acidosis. Also will lead to arrhythmias in the form of tachycardia and hypertension. If carbon dioxide level reaches above the level of 5%, the respiratory center will be stimulated and dyspnea will happen. The patient will suffer from stertorous breathing. If carbon dioxide level reaches 6% for several minutes, affection of the central nervous system, and hearing and vision loss will happen. Above 10% loss of consciousness will happen even if sufficient oxygen is present. If carbon dioxide level reaches 25% for several minutes, the patient will show coma, convulsions, death will occur within 1 to 3 minutes after the beginning of exposure due to the severe acidosis. In clinical picture of chronic toxicity, it may occur while diving and submarines. Prolonged exposure to excessive concentrations, example in submarines and spacecraft. Also, impairment of performance during prolonged exposure to 3% carbon dioxide has been reported when oxygen concentrations is even around 21%. Cerebral and retinal degeneration results in headache, photophobia, abnormalities of the eye movements, personality changes, depression, irritability, and constrictions of peripheral visual fields. The post-mortem picture will include detection of carbon dioxide in the blood and will by determination of blood gases level. Management is the best management, however, involves primary prevention using protective PPE and proper ventilation. If toxicity already happened, then removal of the patient from the area of exposure would be the first step. Precaution must be taken to ensure that the rescuers are not overexposed. So for example, firefighters rescuing victims from fires or from leak incidents, they have to wear a protective equipment before they can go and rescue them. Also, immediate administration of oxygen is essential, followed by cardiopulmonary support as an emergency care, and then correction of acidosis. Now we move to talk about another gas, which is a natural gas. Natural gas is contain a mixture of different gases, for example, methane, ethane, propane, butane, nitrogen, carbon dioxide, and hydrogen disulfide. Properties, it's colorless, and sometimes it has odor because of the hydrogen sulfide, if hydrogen sulfide is present in this natural gas. Health hazards will include irritation of the eye, irritation of the skin. If inhalation happen, there will be like irritation of the respiratory and GIT mucosa in the form of nausea, diarrhea, loss of appetite, dizziness, disorientation, headache, sometimes as rapid respiration, which will be followed by other central nervous system manifestation. Hydrogen sulfide may cause lung paralysis and asphyxia if it is in high concentration. And if this natural gas replaces oxygen in an atmosphere, it will lead to anoxia, dyspnea, cyanosis, and eventually coma. As we talk about health hazard data, because this natural gas is a mixture of gases, research has proposed studies to investigate the effect of each gas by itself on the human body. For example, exposure to 1000 particles per meter propane for 8 hours a day, 5 days a week, for approximately 2 weeks showed no normal reactions, including cardiac, pulmonary, nor neurological functions. If we speak about N-hexane, chronic high levels of N-hexane led to damages of the nervous system, leading to lack of sensations in the extremities, and might progress into severe nerve damage. When it comes to inhalation of high levels, around 1,000 to 5,000 particles per meter of N-hexane, it caused testicular damage in rats. This is not in human, it's in rats. And mice who have been exposed to the same level also showed no effect. So the data is not really clear about the effect of these gases on the human body. And we previously mentioned carbon dioxide exposure. High levels of carbon dioxide exposure leads to acidosis and imbalance of electrolytes in the blood. So, in case of toxicity, emergency treatment will lead to will include eye by flushing of the eyes with lukewarm water for 15 minutes. Irritation or adverse symptoms might develop, so we will need the consultation of a specialist. If skin irritation happened, exactly the same. We will wash the skin with water and soap for decontamination for 15 minutes. Following inhalation of high doses of a natural gas, immediately removing the person from exposure would be the first step, and symptomatic treatment by giving oxygen and respiratory support. Topic, and I would like to thank you for listening and waiting for your questions through my email. Thank you so much.